Dr. Bakris, can you speak to ACE plus ARB use from your perspective?
So we have been writing in the guidelines since, I don't even remember, since the trial came out, since Altitude came out, that you shouldn't be doing this.
We lost a giant in nephrology on the 15th of June, 2024. George Bakris.
The Cosmos trial. So I'm George Bakris, Professor of Medicine, Director of the American Heart Association Comprehensive Hypertension Center at the University of Chicago Medicine. I've been there since 2006, and before that, I was Vice Chairman of Preventive Medicine and ran a clinical trials unit at Rush Medical Center in Chicago. So I'm a nephrologist and clinical trialist, and have been involved in guidelines, FDA panels for cardiorenal disease, and basically a lot of clinical trials, outcome trials on kidney disease.
He was a tremendous clinical scientist, physiologist, clinician, and he was a president of the American Society of Hypertension, and he published so many papers. His CV is just voluminous. But what was greatest about George was the educator that he was.
I wrote them back and I said, I think there's a mistake. You must mean something else. They said, no, this is correct. I said, okay, would you mind, if whoever came up with this idea, would you mind having them send me the information as to where they got this hallucination? So, because SGLT2s do lower blood pressure, let's be clear, but it's about 2 to 3 millimeters. They're certainly not going to be called antihypertensive.
He's one of my dearest friends. We've worked together on the American Journal of Nephrology, several guidelines committees, several consulting groups for newer therapeutic agents for hypertension and chronic kidney disease.
All of us learned so much from George, from reading his papers, from meeting him, from hearing him talk. George talked at our cardiometabolic meeting in 2017 and 2023. He spoke right here in Charleston, South Carolina, where we are now for our 28th annual Hypertension, Diabetes, and Dyslipidemia Conference.
I mean, I've been doing this with Jan for, let's just say 10 years. And every year, he gets the best people that not only are knowledgeable, but who also can convey that knowledge to a primary care audience. I've heard nothing but super positive comments from the audience in the past about the other speakers. So, I think you need to keep it. If it ain't broke, don't fix it. Keep going with what you got.
And he's a family friend, and will be a great loss to all of us, both from a standpoint of his mentorship, leadership, but most importantly, his friendship.
It is such a loss. There's so much sadness, but yet he's had such a brilliant career and he's given us all so much. So, George, we toast you, we appreciate you, and we're sorry you're not in our life.